Hi, my name is Nidhi Sharma. I'm a physical therapist here at Reddy-Care Physical Therapy, and today I'm going to talk about chronic pain. So chronic pain, we see patients with chronic pain every day, and it is often very frustrating and discouraging for patients. They often end up feeling like nothing can make them better, and they're going to have to live with this pain all their life. To make chronic pain better, it's very important to understand why pain sometimes becomes chronic and why it's not controlled by so many things that we try to do. So pain is not just caused by the trauma that you go through or by some abnormality or structural deficit that you have in your body. It is also caused by what our brain thinks of it. So to give you an example, if I fall and I hurt my back, let's say I fall on the floor and I hurt my back. So if I hit my back on the floor or this table, what will happen is the nerves in that part of my body will sense that something has happened, some pressure, some trauma has happened, but they will not create pain. Pain is not created by these nerves in my hand or my elbow or my knee. These tissues or these nerves in my body parts will tell my brain that there has been an injury. And after that, my brain will put together a lot of information that it already knows. For example, have I ever seen anybody get hurt in their back? Have I ever known anybody who got hurt and had a terrible time afterwards? Have I been hurt in past? Have I seen it in movies? Have I read about it? Do I know anything about it from my cultural, social, and educational background? So whatever I know about that injury or related to that injury will be put together by my brain. And then my brain will decide how much danger am I really in. Depending on how much danger my brain thinks I am in, depending on that, my brain will decide how much pain I will have. But a little injury, but a lot of fear from the brain can actually cause a lot of pain. So this has been in research for a long time now, that none of the tissue in the body is able to create pain. Pain is 100% of the time created by your brain. It is modulated by your brain, and body part is just one part of it. Body injury is just one part of it. The rest of it is brain decided. Now, this is not to say that we can think our pain away or we can just decide one day that we're not going to have pain. Because whatever our brain is doing very quick, and it's usually not in our control. It's usually very much subconscious. So, whatever experiences we have in our life, they decide how our brain is going to react to that injury. So what happens in a lot of patients with chronic pain is over and over again they have negative experiences. So if somebody hurts their back, they lose their job, or they're not able to go to their daughter's wedding, they're not able to play with their grandchildren, or they feel disabled in their general life. All these things are related to their pain. All these things, their brain relates to their back pain. So next time when they hurt their back, bending over, the injury might be very little, but the brain will relate all those experiences to the back pain, and it will hurt a lot more, while it would have hurt less if that person did not have all these experiences. So negative experiences sensitize the brain. It makes your brain more afraid that you're going to get hurt and causes a lot more pain. So it is a good thing and a bad thing. It's a good thing because it's a bad thing, first of all, because you cannot really control it. You don't know what your brain is going to do at a subconscious level. But it's a very good thing, because for all those patients who have been told that you have a lot of arthritis in your back and nothing can be done, or you have bone on your knees and nothing can be done, or you can only get surgery, that's the only option, they should know that the physical trauma in their body, the physical tissue damage in their body does not relate to their pain all the time. And more chronic this pain is, less and less it will be proportional to what actual damage is in the body. This is not to say that you should not respect your body damage. Of course you should, but you should also consider that a lot of that pain is probably coming from your brain sensitivity. And in physical therapy, we can help you slowly make all these negative experiences into positive experiences. Like you can walk out of here with less pain, and your brain might start to think that you're okay, that you're out of danger. and you'll learn better body mechanics, will teach you how to do things better, so your brain can think that, oh, now you know how to protect yourself, so you're in less danger. Another thing that is very important for patients with chronic pain is to set functional goals. So I always tell a patient with chronic pain to not make a goal of getting rid of their pain. Of course you want to get rid of their pain, but you should not think that you're coming to therapy to get rid of their pain. You should come to therapy to improve your function. To walk, if you can walk 1 block, you should be able to walk 2 blocks. You should be able to stand for 30 minutes. You should be able to play with your grandchildren. Because all these goals are going to make your brain think that you're getting better. So your brain needs to have all these positive experiences so that it can let go of the fear that is living in. And third very important factor is stress. Stress and depression are 2 things that makes the brain very, very sensitive. So a sad, miserable brain is probably going to have more pain or going to create more pain than a happy brain. Exercises releases endorphins, which elevates mood, which will probably make your central nervous system less sensitive and create less pain. So our message to all the patients with chronic pain is, although you've been told that it cannot get better, that your tissue damage is so much that it cannot get better, please understand that a lot of that pain is coming from your brain sensitivity, from your nervous system sensitivity, and hence that can get better. So please don't give up.